the single innovation that has improved in the sector in terms of the outcomes, if I talk about Yashoda?
We have recently launched our flagship hospital by the name of Yashoda Medicity. For the first time, I think in the world, we have come up with the concept wherein real means we have created hospital within the hospitals. We have integrated the whole of diagnostics that includes even MRI, CAT scan, ultrasound, X-ray, echo, everything only for the patients who are landing to ER in emergency conditions. It has never been done ever in the world.
Is there any particular innovation at Yashoda that you want to mention?
We have, tried to create a new era of Indian healthcare with this setup. We are trying to make it as a global healthcare destination. So there are a lot of things which we have bring in for the first time. The kind of mix of technology which we have bring in radiation oncology. We have bring in this self-assistance kiosk.
Is there any behavior change in the adoption also when we're talking about AI-driven robotic surgeries that they are happening in the sector? Hello and welcome to ISW Podcast. I am Sukshim Sharma, your host for today, as we are joined by the visionaries who are shaping the next chapter of healthcare with digital transformation. Right now, I have Mr. Sunil Dagar from Yashoda Group of Hospitals. He's the CEO there, and let's get the conversation started. So I would like to know that, the single innovation that has improved in the sector in terms of the outcomes. What is there that is, there if I talk about Yashoda?
So if we talk about Yashoda, we have recently, launched our flagship hospital by the name of Yashoda Medicity. And I think for the first time, I think in the world, we have come up with the concept, wherein in real means we have created hospital within the hospitals. And that starts right from our emergency medicine and trauma care department. We call it as Yashoda Institute of Emergency and Trauma Care. We have, integrated the whole of diagnostics, diagnostics that includes even MRI, CAT scan, ultrasound, X-ray, echo, everything only for the patients who are landing to ER in emergency conditions. It has never been done ever in the world. And that's all, integrated through EMR, wherein every step of the patient journey which comes to ER is being tracked on real-time basis. And it has been backed by, data analytics of best practices across the world in terms of the clinical outcomes, wherein by the time you punch in a provisional diagnosis for a patient, you are being guided through a clinical standardized pathway to treat that patient and manage that patient, whether it is your diagnostics or the clinical management. And at the same time, it is being tracked on real-time basis that for every step, what are the benchmarks you follow so that you are well in time and the patient is being managed in a standardized time frame.
Right. So if since you talked about the patient journey and everything, so is there any behavior change in the adoption also when we're talking about, digital transformation and, AI-driven robotic surgeries that they are happening in the sector? So is there any behavioral change in terms of when we talk about adoption?
No, I agree on that part. What you have asked, that yes, it's all about a behavioral change which needs to happen whenever you are innovating something, whenever you are bringing some change. And that happens right from the planning of that particular innovation, be it in terms of technology, be it in terms of infra, be it in terms of the processes which you come up with. So then that at that time the leadership role comes in place, wherein you have to put the team at one place. You have to create that ecosystem wherein everyone is working at the same wavelength. They understand each another, that their interdepartmental or intra-departmental things are put up in place so that that innovation goes on smoothly, seamlessly, and that change comes in place and that adoption comes in place, and ultimately the patient is being benefited through a better outcome, which can be of world class as well.
Is there any counseling that is happening on the back end when we talk to patients on daily basis?
in terms
In
of
terms
the
of educating them for robotics or
yes, yes,
AI-driven
yes, yes.
surgeries? Yeah.
Whenever you launch such programs, be it robotics, I give you an example. Yashoda Super Speciality Hospitals, a group of hospitals, we are working for the past 35 plus years now. And we have been into robotic program for the last 3 years now in Ghaziabad. And we were planning to launch this robotic program in the specialties of urology, gynecology, minimal access surgery, surgical oncology, and head and neck surgeries. That time it took almost 6 to 9 months, to have that understanding that which technology you want to bring in. And at the same time, there was a lot of brainstorming sessions which has gone in place with our clinicians and the technical team which works with the clinicians, as you said, that the counseling part, which is very important, wherein you have to make that patient and their family member understand what is the utility and what are the benefits of this technology innovation and how it can change the overall outcome from the patient's perspective. Because for patient, it's only their clinical outcome they are ultimately concerned or bothered about. So that is the foremost thing which happens when consultation is being done by a doctor to a patient, and they are being provided options with. And once they are convinced, yes, we want to go for a robotic surgical treatment, then obviously there are counselors in place where then they talk about in detail about pre-surgery, during surgery, and post-surgery, how the journey will take place. And once you give that confidence to that patients, you're done.
Is there any particular innovation at Yashoda that you want to mention, which is, which will be, talked about in future most, and when we talk about Yashoda group of hospitals?
So since it's our flagship and it's a futuristic hospital, it's we have tried to create a new era of Indian healthcare with this setup, and we are trying to make it as a global healthcare destination for patients, obviously from overseas as well. So there are a lot of things which we have bring in for the first time. The kind of mix of technology which we have bring in radiation oncology, into robotics and AI, and as well as from at a smaller level also from patients per experience, we have bring in this self assistance kiosk, which works on a conversational AI, which is a new thing now. We had been using EMR for years, wherein the doctor types in or just work through their tabs and select the options and create a prescription. But now it's the next level, wherein the conversational AI works in. Even at a self-assistant kiosk, the patient, if they are not aware of that which doctor they need to consult for their issues, they just have to tell their symptoms, and with that data enabled AI, they are being provided with the specialty and as well as the available doctors option, and they can select from their preference. Even they can get into the detailing of each and every doctor's profile, and they can choose at their own with their reviews, with their experience and their competence, which they brings in. So this is one small innovation, I would say, which we have bring in. And the same thing continued in the consultation room also, wherein the doctor, while just like we are talking, and if a doctor and patient is talking about their history, their clinical condition, that all can be formulated into a structured prescription.
Right. So, talking about the hospital, sir, what are the non-negotiables at the hospital right now in terms of
For
day-to-day working? If I
see,
say,
we call it as a smart and green hospital. So being a healthcare player, the non-negotiables for our Yashoda Medicity would be that the hospital is not just a mechanized or a hospital with all equipments, robotics, and but we have to make it in real means a smart hospital which is backed up by technology, providing right right thing at right time, wherein minimizing the stress of our patients, their attendants, and our clinical staff, ensuring a delighted experience for our patients. So this is something which is non-negotiable.
any message that you want to give for our audience who are still not, into the smart care working, and who are completely unaware about the working and everything where robotic surgery is concerned and everything. So anything that you want to say?
So, my message to the common people is that yes, through our the technology around which we use on day in day out, like our smartphones, you can enable yourself, you can make yourself aware about the available technologies which are at are available at very affordable cost. But yes, it's always better to get into deep insight, and if you need anything clinical understanding for any particular disease or treatment, it's always better to get in touch with your doctor rather than just following the search engines, wherein very generic and shallow information is being provided. But yes, if you go to a doctor, it's always man behind the machine, it's the man behind the technology which is actually making that technology and machinery usable for a patient perspective. So it's always better to go to the doctor and then understand.
Thank
Thank
you
you.
so much, sir.